The purpose of this video is to give you a little bit of pre-information before your appointment, so you can go in there with many of your questions answered, and you and your practitioner can just focus on you and what your needs are. Guys are pretty easy for the most part to have this conversation with and to balance, if you will. We're primarily just looking at testosterone in men. Women, a little more intricate details with all the other hormones that women need balanced, but guys are pretty simple. And really what our goal is to get your testosterone levels up into a more optimal range. And for males, that's around 1,000. It's really between 900 and 1,1200. And that's a first interesting concept I want you to understand, because often males come into our practices saying, you know what, I went to my doctor and he said my testosterone levels were normal. Well, just let me tell you that the lab reference range on a male testosterone is 200 to 1,200. So if you fell anywhere in that gamut, you're going to be called normal. Men start to feel symptomatic with low testosterone symptoms when their levels fall below 500-600. And a lot of guys don't understand that all those brain symptoms they're feeling, brain fog, can't focus, that it's on the tip of my tongue, you know, the brain and the tongue aren't matching, that word search, afternoon fatigue, hitting a wall 2 to 4 in the afternoon, trying to find a Starbucks or a Red Bull or some sort of energy drink to get you through the rest of your workday. Mental fog, mental clarity, all those brain symptoms are testosterone decline. The lower your testosterone levels get below 500, the worse those symptoms become. As they get towards the 300, 200 and below level, men get irritable, anxious, very moody, have big mood swings. So a lot of the misconception of testosterone and aggression is really wrong. Natural testosterone in optimal levels actually evens out male moods. It doesn't make them aggressive. We are not trying to get your levels into an aggressive level. That's 2,000 and 3,000 at our Reuters when they do injectable testosterone. They get their levels up really high. We're not doing that. That's not what we're doing here. And a lot of guys have this misconception that because they have a sex drive and they have a desire, that their testosterone level must be okay. Well, I can tell you guys rarely, if ever, lose a sex drive. But sexual function does go. And as male testosterone levels fall, 500, 400, 300, 200, erectile function gets less, morning erections decrease, and so forth and so on. So although a sex drive is still there, sexual function and performance is not what it once was as your testosterone levels fall. So brain fog, focus, all the brain symptoms, muscle mass loss. This is a big one that our guys complain about, and the big one that they say returns very quickly when they get their testosterone levels back up. They start to lose muscle mass. They start to get a belly around the middle. Well, that belly around the middle comes because as your testosterone levels fall, your cortisol levels go up, and that's what increases that belly fat. So we see a reversal in our guys in that actually pretty quickly, way quicker than the women. So if you have wives on this therapy, they're going to get very annoyed with you that you're getting into shape quicker than they are, but they'll get there. So muscle mass increase, stamina in the gym, endurance. I have runners, I have triathletes that get this testosterone pellet therapy, and they say their stamina is so much better, their post-workout recovery times are less, their soreness is less. So an overall changing your physique back to 20-year-old levels, and sometimes even better than 20-year-old levels, because a lot of guys have been low testosterone their whole life and they didn't even know it. We're finding more and more young men with low testosterone, in their 20s and on into their 30s. So this isn't just a problem of, 50-year-old guys or older. This can be a problem starting from as young as 19. I have in my practice young guys. There's a lot of factors to that, environmental factors, hormones in our foods, many things that I won't go into here. But I tell you that just to if you know somebody that is young or you think is too young for this therapy, you may want to think again if they're having some of these symptoms. What can you expect? Well, your practitioner has been trained in a method that doses testosterone specific to you. We dose the pellets on parameters of your age, your weight, your blood levels, your activity levels, and then we retest you 4 to 5 weeks after your insertion to make sure your practitioner did their job and got your levels where they need to be. If you were underdosed for whatever reason, if any reason, we rarely have to do this, but your practitioner will bring you back in for a booster, because it's our job to get your levels right, and we want to know what your dose is so moving forward, we know what works for you. So most guys can expect to come in for their hormone pellets about twice a year, and that sure as heck beats the weekly injections that a lot of guys have to do. Moreover, the long-term benefits of having your testosterone levels up and balanced 24/7, huge reductions for men in Alzheimer's disease risk reduction, 70% for men. What we find is men with a low testosterone are 3 times more likely to develop Alzheimer's dementia, so very protective for the brain. Heart protection, lots of studies coming out in men over 55 or who studied that show actual reversals in plaques in the coronaries and decrease in reduction of coronary artery disease. So many other things in women: osteoporosis, osteopenia protection, and breast cancer protection, prostate protection. Men, a lot of guys have this misconception that they can't get testosterone because they've had prostate issues in the past or prostate cancer in the past. It's actually increased estrogen that stimulates prostate cancer risk. So as a man ages and his testosterone levels fall and his estrogen levels come up, that's what stimulates that prostate cancer. So we do this therapy in prostate cancer survivors when they're 2 years out. We have many questions that we answer in the consult, but what I found in my practice after thousands of patients is often we give you so much information you forget a lot of the key things, like how long does it take to work, how long does it last, and so forth. So those are the questions I'm going to briefly answer for you here. First question is, when will I feel good, right? So how long will it take me to feel good? So the majority of patients report, men and women, that first week their sleep is improved, sleeping all through the night for the first time in many years for a lot of people. By the second week, that brain fog is kind of lifting. It's a good analogy is, I've been walking around with the dimmers on and the dimmers are coming up and I can see and I can think clearly, right? So about that second week is when those symptoms start to relieve. The brain fog lifts, the mental clarity, mental focus. By about the third week, we're seeing, and sometimes even sooner, moods level out. Anxiety is lifted if you were having some of those symptoms. The mood swings are going away, which makes your family very happy, right? Your significant other, your children, everyone around you, your coworkers, and so forth. So expect that about 2 to 3 weeks. 3 to 4 weeks is when you're really on a climb towards the peak of your hormone pellet therapy. And that's when women report an energy surge, a libido surge. A lot of guys are going, when are you going to get your sex drive back? Well, that typically kicks in at about 3 weeks. So at the 4-week peak is when you peak on your pellets. And then after that is when we want to get your blood work. So somewhere between 5 and 6 weeks for men and women is when we're going to get your blood work to make sure your practitioner did his or her job and got your hormone levels where they need to be. If you're underdosed for any reason, they will bring you back in for a visit and possibly do a booster on you. And that's just to get you right. So moving forward, we know what your sweet spot is, what dose you need, and in subsequent rounds, we know where your needs are. After that, women typically last somewhere between 4 and 5 months. Men last somewhere between 5 and 6 months. You'll know when it's time to come back in for your repeat insertion because those symptoms that were lifted will start kind of creeping back in somewhere around that 4, 5, 6 month marker. And if you don't notice it, trust me, one of your significant other or your partner or your children, somebody will notice it and you'll know it's time. Most practitioners don't get lab work every time you come in for your pellets. It's not typical. We typically get blood work once a year after we've established your dose just to kind of keep an eye on things and make sure everything's kind of humming along the way it should be. I hope this helped you out and I wish you well. Welcome to your new life.